Hi, and welcome to season 2 of our podcast, Innovation and the Future of Pharmacovigilance. This is a podcast series brought to you by Trudient Talks. I'm your host, Indy Alawalia, and I'm delighted to navigate the dynamic world of pharmacovigilance and risk management with you. As always, a quick disclaimer. The opinions expressed in this episode are solely those of the individual guest and do not necessarily reflect the official views of Trudient Consulting or their own company. We're all about fostering insightful conversations here at Trudient Talks, and we want you to know that any product, vendor, or service mentioned does not imply an endorsement. If you're seeking any professional advice for specific situations, we encourage you to go speak to our experts. Please remember, this podcast content is meant for informational and educational purposes only. So, Season 2. And for episode 1, we have today the incredible fortune to have the magnificent MBB, Senior Director, Safety Strategy at Oracle, as our guest speaker. Michael, thank you so much for coming in and being our opener for Season 2.
Thanks, Indy, for inviting me. Really excited to talk to you about innovation. It's one of my favorite topics.
and Michael, you've been around the circuit, as it were, of PV. But what I really want to know is, how did you get started in PV?
Oh, well, that was many, many years ago. Actually, about 30 years ago now. I started in the PV department of Fujisawa. I was a student at that time, and my first job ever in PV was filing AE forms into patient binders. So at that time, everything was still paper, right? So we used to get the AE forms on paper with real carbon copy, and I was pulling those apart and filing those in different binders. And then I got offered a full-time job there. I started out doing named patient use, compassionate use. So kind of administering that program. Then I did data entry of adverse events. And then I really did almost everything in the PV department, learning by doing, right? So I studied linguistics, so nothing to do with pharma. I just happened to get that job filing papers because somebody I knew in the pharmacovigilance department told me they have a student job open.
I think that's the way with a lot of people, that they just suddenly, oh, here we are, we're in PV.
Yeah. So then I started, they kind of saw that I had some talent on more on the database side. So I started doing more IT type things. I was actually in the PV department, but kind of the interface between the business side of PV and then the actual IT department. And then in the end, I was managing a small group, 3 or 4 people, called the Safety Data and Quality Management Team. So the safety data management was basically being an admin for Argus, a business admin, so not a DBA, but like going into making the configurations in Argus for studies and products and things like that, and also doing data retrieval, going in and running reports and for people in the department. And then the safety quality management side was writing SOPs for the safety department. So yeah, that was a really interesting mix, and got to do a lot of exciting things. We used to have a homegrown system when I started out there. So I would, when we needed a new feature, I would just go down to the IT department, one level lower, and say, oh, could you put a field like this on the screen here? And they would like do it in real time, and like, how about this? Do you like this? This was the days before validation and all that, right?
Yeah.
And then, the company decided to get Argus and migrate from our homegrown system. So I was involved in that project, and then, Argus upgrades. And then, of course, E2B came along, right, where we moved from paper to electronic, and that was a really big deal, right? The EMA was there, but they didn't really have a lot of the authority that they have now. So we had to, test E2B with each authority in Europe. That was quite a long but very interesting project. So and I did that for like 13 years. Fujisawa eventually became Astellas. So I was there in the PV department for 13 years. Then eventually I went to the vendor of Argus, which was Relsys, and started in the strategy team there. And then after 2 years, we were acquired by Oracle. That's how I came to Oracle, stayed in the strategy team. And now I've been at Oracle for 15 years. So it's the time flies by, but it's actually been like 3 decades now doing PV.
Wow. And you like to stay places as well. You like to stay places a long time.
I do. I admit it.
And that you've had 2 very interesting changes in your career. Then you went from Fujisawa, and then did it get acquired by Astellas, or did it eventually just become Astellas?
It was a merger, really, between 2 similarly sized Japanese companies. So it was my company was Fujisawa, the other company was Yamanouchi, and then they merged and changed the name to Astellas. So that was interesting. Also, working for a Japanese company was very interesting. For 13 years. And I'm originally American, but living in Germany for 35 years now. So, I was American living in Germany, working for a Japanese company. So very global experience, I guess.
Yeah. And what was that experience like? I mean, obviously, compared to staying at Fujisawa, you didn't spend so much time at the combined Astellas. Was there integration problems at the time, or was it just the case that you felt it was time to move on?
So actually, so there was a program to look at the 2 safety systems that so Yamanouchi and Fujisawa had 2 different safety systems. We looked at both ones, and we also looked at other safety systems, and decided in the end to move everybody onto Argus. So there was a migration project, which I was part of. And that was obviously successful. And then the reason for leaving at the end was actually that they had from the two predecessor companies, Fujisawa and Yamanouchi, they had 2 European headquarters. One in Munich, where I live, and one in the Netherlands. And then after some years of doing that, and it was separated by products, basically. So the Munich center took care of the products from Fujisawa, legacy Fujisawa, and vice versa. And then they decided to merge the 2 departments into one, and they decided to close the Munich office. So that was the point when I and a lot of other people who wanted to stay in Munich, had a house and family in Munich. That was kind of the decision.
So pretty straightforward. And then the second thing major that happened in your career was obviously you went to Relsys, and then Relsys were acquired by Oracle. I mean, that must have been quite a different state from a small company into a large conglomerate company.
Yeah, that was also quite interesting. I learned about Relsys through just being a customer, through being an Argus customer. And then I started going to, they had annual user group meetings.
Mm-hmm.
And I would often go to those, and those were really interesting. I got to meet the people at Relsys, got to meet the other customers, often was able to do presentations on what we were doing with Argus and hear how other customers are using Argus. So that's how I kind of got to know the Relsys team and really liked them. And that was kind of a big part of the decision to go to Relsys. Yeah, with the acquisition, then so it's quite interesting. Relsys was a pretty small company, right? In Europe, I think we were 5 people altogether.
Wow, I didn't realize it was that small.
Yeah, I mean the whole company was bigger than that. I think we were probably 130 people, something like that, but only 5 in Europe.
Wow.
And so in a small company like that, you end up wearing many hats, right? You jump to whatever needs to be done, right? So although I was, officially in the strategy department, strategy was just part of my job, right? So I was involved in a fairly big project to implement Argus at a large pharmaceutical company, and just sort of jumped around to many different things that needed to be done. Right, that's the way a small company works. So with the acquisition by Oracle, I really got a chance to focus on the strategy part, and because that, obviously Oracle has enough people to do all the different jobs, and then so that was actually quite nice in a way, to be able to focus on strategy and not have to sort of jump into 100 other things. But of course, it's a large company, and its large company culture is different to small company culture, and so that is a change. But Oracle is acquiring companies all the time, so they have actually a very sort of time-honored process the way that they do that, and the onboarding and so on. They're used to that. So often when you meet other people from Oracle, first question is native or acquired?
Wow. That's fantastic. And you've been at Oracle for 15 years.
Yeah.
Give or take.
15 years now with the change to the new year, yeah.
Wow. And 15 years. The Argus was it must have been a fairly early number, maybe 3 or 4 when you first started. Is that right?
So Argus was born in 1997, actually, and went through many innovations over the years. So let's see. When I joined, I think there was already the web version of Argus, right? It started out as a client server application, then switched to web. And I think shortly after I joined, we introduced Argus Cloud for the first time. We introduced Argus Analytics for the first time. We introduced the CRO mode for Argus with the multi-tenancy supporting multiple clients. So it was a really interesting time to join, and a lot of exciting things happened along the way.
Yeah, I can imagine the changes from when you joined to where it is now must be really significant. There is a level of disdain towards Argus, though, for not being necessarily innovative. What What's your thoughts on that?
So I have heard that as well. I think there's three reasons behind that. So first of all, I think it's not actually true. I think we are quite innovative. I mean, in the last 3 years alone, we have introduced a completely new UI for Empirica, which has like built-in dashboards, built-in visualizations, makes work much more efficient, much less clicks to get to where you want to go, and seeing basically important things on the screen in color that you need to attend to right away. We introduced Safety One Intake, which is our very first AI-powered product in Oracle Life Sciences. So that is using AI to automatically extract information from safety source documents, whether they're structured or unstructured documents, and put them directly into Argus, which basically bypasses the manual data entry step in Argus, right? So it's a huge time saver. What else? We just introduced our first AI feature in Argus. Probably many people don't know about that, and that is a feature for automatic translation of its outbound translation. So, for instance, if you have to send the narrative to a certain authority in a certain language, you can use that. So I think we are actually quite innovative, but people might not know about it. And that leads me sort of to the second reason is I think people are getting a lot of their information from third parties, perhaps. Mm-hmm. I heard that Argus hasn't changed in years, that kind of thing. So I would encourage people to, come to the source. Please contact me or anyone at Oracle, and we can really tell you about the innovative things that we've been doing. One good way to stay up to date is the Oracle Safety Consortium, where we meet on a monthly basis remotely, and we try to meet twice a year face-to-face, once in Europe, once in North America. And there you can really get very up-to-date news about what we're doing, also what other customers are doing, and so on. And then the third reason, which might be the most important reason, is our approach to innovation, I think, which is called continuous innovation, which is sort of an approach to continuously innovate in an incremental way, always adding on new innovations over time. And that is in contrast to discontinuous innovation, which is much more disruptive and flashy, right? So I think part of it is that we have this continuous innovation approach where we are steadily innovating, bringing out new innovations with every release, but it might not be as flashy as some other vendors, right? However, I think that the continuous innovation approach is the right way to go in safety, because this is a high-risk business, right? There are patient lives at stake here, right? And nothing against being disruptive, which can be good, but you have to be careful, right? In an area of high risk like patient safety. And that's why we kind of decided not to throw out Argus and Empirica and start over, right? Both those products were, they just both happened to be, first release was in 1997, so they're over 25 years now. And instead of seeing that as a liability, we see that as an asset, right? Because first and foremost, a safety system has to be compliant, right? And that compliance is not easy, right? For people on the outside of the safety world looking in, it seems sometimes easy to make a safety system, right? You just make a rules engine and you're good to go, right? But we've seen through experience that it's a lot more than that, right? Regulations are changing throughout the world ever faster. They're on different schedules, right? So Japan has a different release schedule from EMA and FDA. And then even things which are supposed to be worldwide standards like E2BR3, every country or region has their own flavor, right? Where they add their own fields, right? Yeah. And so things are constantly changing. The health authorities now have a new trend, which is even if they're not sort of finished with the new regulation, they already put it into production, and then they kind of see how it works, and then they get feedback, and then they change things, right? Mm-hmm. And they're giving pharma companies ever smaller and smaller time periods to prepare. So yeah, it's a very difficult situation to have control over and make sure that you're compliant. And it took us years of hard work, working with the authorities, working with customers to get Argus and Empirica compliant. And we don't want to throw that away, right? Because when you start from brand new, it's always the problem with 1.0 software, right? And you have to work out the kinks, and there's going to be lots of bugs. And trying to be compliant with all these regulations around the world as they're in movement, changing, is really, really hard. So we see the maturity of the systems as an asset. It's a strong foundation that we innovate on top of, right? So. So we're adding AI features to Argus, to Empirica, to Safety One Intake, but built on that strong foundation rather than starting from scratch. And that approach, is probably makes less of an impact, less of a flash in the marketplace, where it makes it look, because the products have a long history, it looks like we're not doing anything. When in fact we are, and you can see that if you talk to me, and we can show you what we're doing, right? I mean, truly, in my heart, I think Argus and Empirica are really, really good pieces of software. I think I honestly believe that, and I think they're our strongest assets.
Thank you, Michael. I know that was it was a tough question, but I had to ask it. And actually, you touched upon something there which is really interesting, which is how vendors interact with regulatory authorities, specifically the EMA. It's noted, recently we've had 2 regulatory agencies go with more, let's call them what everyone else calls them, which is next generation safety software. We've had the MHRA, obviously, they've chosen Halo PV from Insight, and we had the EMA choose RX Logics. Now, I remember in some meetings, some information days with the EMA where they were very much unwilling to work with vendors. It seems that they've totally gone the other way and suddenly opened up, but maybe not to yourselves. I don't know what your thoughts on that is.
So we do work with health authorities. There are a few health authorities that use our software. In the end, that is their decision, right? We think we have a strong offering on both the case management and signal management side of things. Of course, for health authorities, the signaling and analysis part is more important than the case processing, right? Which they have to do sometimes, but most of the times that is done by the pharma companies. But we do work with with several health authorities, and actually, Empirica was created through basically a co-development with the FDA.
Mm-hmm.
So we are used to working with health authorities, and we'll continue to do so, no matter if individual health authorities decide to go with other systems. But yeah, we're happy to work with them, and we think we have a strong offering for them, as well as for pharma companies, biotechs, medical device companies, CROs. So I think we have a strong presence in all the different life science organizations.
And another thing I was just thinking about was the maybe going back to the innovation piece, which is there's a lot of lofty claims being told right now. One of the ones that I hear a lot is about touchless cases. And the reality is now there is no single software that could truly do touchless cases. In your opinion, do you think truly touchless is close, or do you think PV is not ready yet for true touchless cases?
I don't think we're there quite yet. We're on the pathway to get there. We are working on something called augmented AI, where it's basically the AI and people working together. So in some cases, the AI can make decisions. In other cases, you want the AI to sort of make an analysis and provide candidates, let's say, but then the human makes the final decision. So let's take duplicate check as an example. So the AI can look in the database and see if there are good candidates for being a duplicate. It can give a score to each candidate as to how confident it is that it is a true duplicate case. So let's say from 0 to 100, and it can present, the user with, let's say, the top 10 and with their scores, but then the user can make the final decision, right? So I think we're first sort of moving into that territory with augmented AI. Until people become more familiar and through testing see that the AI is actually doing its job, before we move to true touchless. The other thing is, if I can sort of continue with this continuous innovation approach I was talking about before, I think it's a mistake to try to make your entire workflow touchless in one fell swoop, right? Because first of all, it's a huge task. There's lots of things that you have to do. Second of all, if something goes wrong, right, and something probably will go wrong in the first attempt, you won't know where the problem is, right? Because instead of just changing one thing, you've changed 100 things, and now something went wrong along the way. Where's the problem, right? So I like to advocate this continuous innovation approach, where you start with one thing you want to automate with AI. And which thing do you start with? Well, we also had that question, and we decided to start with case intake. Why? Because it's one of the steps, because of the manual data entry part of intake. That's one of the steps that takes the most time, right, in the workflow. And of course, you're trying to process the case as quickly as possible, so that you get the expedited report out the door as quickly as possible, so that you stay compliant, right? And so, when we looked at how much time it takes in the different parts of the workflow, case intake seemed like a good return on investment. Like, you could focus on that and maybe get reduce the time that it takes to process a case by 50%, let's say, because manual data entry takes so long, right?
Mm-hmm.
And then the other good thing about intake, so you can also say, for instance, medical review takes a long time, right?
Mm-hmm.
But with case intake, you have the correct answer there, right? You have the source document that you can always look at and see, did the AI do it right? Did it? So in our case, Safety One intake is extracting the information out of the document automatically and populating that extracted information into the Argus fields, right? But if you want to check if it did it right, you can always open the source document, which is also stored in Argus, and just check. With medical review, that's not so easy, right? So if the AI is doing the medical review and you want to check, did it do the right answer? How do you check that, right? So that's why case intake seems like the ideal way to start. But, it might be different in different organizations. You should look at where, in your process, where your bottlenecks are, where your pain points are, where you have a lot of manual processes, and focus on those first, and then get that right. Yeah. Implement the AI or the automation if you're not using AI, and then do sampling. Do a lot of sampling at the beginning. Sampling is when you just do the process manually to check that the AI is doing it correctly. And then over time, you can reduce the sampling rate. You should probably never reduce it to 0 because inspector from the health authority can come and ask you, how are you sure that the AI is doing the right thing? But, even with humans doing the work, you're also doing probably a QA or QC check every month, right? You take some random sampling of cases from the past month and you double check them that they've been entered the right way by the humans. So it's the same thing with the AI, right? You'll do a random sampling every month and check some of the cases and see that the AI did the proper work. And only once you get that right, then would I move into the next area. And then, work one area at a time until you have a fully automated process. So that I think is, in a very long-winded answer to your question, that is how I think we're going to get to touchless case processing ultimately. Those saying now, you can do touchless case processing today, and it's easy. Just install our product and you move to touchless like that. Frankly, I don't believe them.
That's a fair point. Like I said, I've seen a lot of lofty claims. There's another part to AI which I don't necessarily want to carry on talking about, but there are things about how the models will be trained, how the models will be validated, who owns the data that trains that that model. If that model is using that data to train on, then who owns the model? There's so many questions that are there, which are very easy to overlook, but I suspect in the future will become very prevalent in our industry. But I was thinking about something that you'd said, which was about processes. And I wanted to, again, go back to this question, I'm sorry, about this sort of frustration with Argus. Do you think some of it actually is due to the fact that when people bring in a system, they could be at a competitor and they move to Argus, or they haven't got a system and the first system that they use is Argus? Is a lot of the frustration actually from the fact that the processes have not been changed, and so they expect Argus to be the process and not at all? Could that be also one of the areas where it comes from?
I think so, yes. We've actually been working with a lot of customers over the last 5 years on optimizing their workflow and their processes. I think this comes from the fact that many people developed their case processing workflow in the days of paper, right? Where you literally were moving, a paper AE form from one person's desk to another, right?
Yeah.
And of course, things are much different today. They're very electronic. A lot of those steps in the workflow might not make any sense anymore, right? But people get sort of stuck in doing things a certain way, and you do it for years, and then it just becomes the way to do things, right? So we've been working with quite a few customers. I think it's more than 25 by now on optimizing their workflow. So, really looking at the steps. Are all those steps necessary? Do things need to be modified? And are things being done manually that could be automated, right? There's actually a lot of automation features built into Argus that not everyone knows about, that allow you to automate many of the steps within Argus. Some of those automations may make sense for you as a company, some may not. Some may depend on what kind of case it is. You may want to put more automation on non-serious cases than serious cases, for example. But I agree with you. A lot of things can be helped, made more efficient by looking at the processes and seeing how those can be made more efficient. And of course, when you automate, when you move to AI, you also have to look at changing your processes, right? To adapt to that new technology. People will be doing things in a different way, sometimes slightly different, sometimes more different. And then, you have to have people who are familiar with what the AI is doing, are able to, let's say, retrain the AI when that's needed, be able to validate the AI, be able to explain to an inspector what the AI is doing, right? So yeah, process change is a big part of this whole equation, I think, with the, in quotes, digital transformation, right? That's part of all that.
Yeah, it's interesting. Last year we did a webinar talking about change, people in the change, and culture, etc. And that's just as important as well. I think it tends to get knocked off when with regards to any sort of digital transformation. I think the conversation about people always tends to go away. Another thing that we've spent a lot of time in the last series of the podcast talking about is about the fact that there are less entry level roles in PV now, because they're either outsourced to big vendors in either Eastern Europe or in Asia, and someone like yourself, someone like me, who actually started very junior in PV, and the roles that will probably be around, like you said, you were talking about your augmented AI. I think I've called it human in the loop in the past, which is you need some experience to be able to do any of that. So where do the entry level jobs come from in your opinion?
Yeah, that is a good question. I think perhaps people are now starting more at CROs rather than the pharma company directly. It's also, of course, when people are looking at areas to study, I think now data science is a very interesting area. It's going to become more and more relevant for PV, right? So if you still if you're still studying and thinking about, what are relevant areas to study, I would really recommend data science. And if you can do sort of a specialization in pharmacovigilance, even better, right? There's very few people in the world that know both of those things. But yeah, I think, I think the AI isn't really getting rid of jobs. I think it is allowing the PV department to focus their human resources on more high-level activities, right? High-value activities. Yeah, you may not be doing data entry of cases anymore, but is that really such an exciting job? Would you be more interested in doing medical review or signal detection, right, or analysis of the data, querying the database and things like that? So I think there's where the pharma company had to focus a lot of their resources on kind of these routine tasks that are don't bring a lot of value but have to be done. Now they can, if they give that to the AI, then they can focus their human resources on much more interesting work, I think. And so I think there will always be entry level work, but it looks completely different than, that first job that I did of where they handed me a stack of papers like this big and said, file this. I think those days are gone, and I think we're all happy that they
are. It was funny. I was thinking just the other day, when I was at ASI, we used to have paper files as well, and I remember when the discussion happened about first going into non-paper format, basically PDFs, and not printing things out. I remember the very early conversations of that, and that was scandalous at the time. And even going to e-fax, like not having a physical fax.
Mm-hmm.
And you're right. I mean, you talk about data science. I mean, let's be honest here. You were big on the analytics side for a majority of your career in Oracle. So you do have a little soft spot for that. I'm sure you do.
Yep.
But the whole point of this podcast is really to talk about the innovation and future. That's the name of the podcast. And we've talked a lot about AI today. We've talked a tiny bit about data analytics. But what is the next step for PV? Where do we go from here?
So I think the answer to that is real world data. Mm-hmm. We're used to looking at certain sort of traditional data sets for many years in PV, right? We look at databases of adverse reactions. Those can be private databases like Argus. Those can be public databases like FAIRS and VAERS and Vigibase. We're used to looking at literature databases, right? Literature articles. We're used to looking at clinical trial data, SAEs coming from clinical trials. What I think is a really exciting new area is the so-called secondary use of data. So that is real world data that was designed for some other purpose, not really for safety, but can be used for safety purposes, right? So we're talking about electronic health records, right? We're talking about administrative claims data, which are basically used to decide, how to fund healthcare. So that can either come from a health insurance company or it can come from the government, right? So those kinds of real world data sets, I think are a treasure trove. because you could find signals in there potentially, or maybe you could validate signals that you find. You find the signal in the traditional data sets, and then you want to validate it in the real world data. So I think that is a really interesting area, and I think that, in addition to moving to AI, I think this is where the future of pharmacovigilance is going. Now the challenge is when you have more and more data sets, how do you evaluate the answers that you're getting across multiple data sets, right?
Mm-hmm.
And we've seen that different data sets have different strengths, right? Clinical trial data is usually very, very good data, validated data. There's just not a lot of it, right? Because there's not many patients in a clinical trial. So each data set has kind of its strengths and weaknesses. So the first challenge is to kind of develop algorithms that are specific to that data set to kind of take advantage of the strengths of that data set and get the best results. And then when you get results from these different data sets, let's say you're looking for a signal score for a particular product event combination. So let's say you get one signal score from data set A and a different signal score from data set B and another signal score from data set C. So which one is correct, right? So we are working on this thing which we call multimodal signaling that kind of aggregates the signal scores across multiple data sets and comes up with one signal score that kind of takes into account the different signal scores. So trying to help people understand, getting more data is great. In safety, more data is always better.
Yeah.
But then how to interpret that data is the next challenge, and we're trying to work on ways to help people do that.
I think that's fascinating. When you were talking about where the data comes from, even the real world data you were talking about, that's still quite sanitized data, though, isn't it? There's a biggie out there which no one wants to touch, which is actual real world social media data, which I can see why people don't want to touch, but it's still something untapped, right? It's still a problem that people don't know the answer to.
That's right, and we're also looking into that, and some companies are doing that as well. Some pharma companies. There has been, a few years ago, there was this PPP project, private-public partnership called Web Radar, where they looked at that exactly, right? They did a study over several years, and they looked at signals that they could find in social media data, and then whether they would have found those signals earlier using the social media data. And I think the answer was pretty much negative, right? The conclusion was that it didn't really bring a value. But it's still, I think, an open question. I think people are still looking at that. There's, of course, different kinds of social media data, right? There's Facebook and Twitter, or X, I guess now. And then there's like really focused social media, like Patients Like Me, right? Where you have patients that might all share a particular illness, are getting together and discussing among themselves, and part of what they're discussing might be what therapies they're taking and if they're having any side effects from those therapies, right? And you might look at that data as having a higher veracity than something that's coming off of Facebook. So that, I think, is an element of it, but I think it's something we're continuing to explore. and could very well be a part of this big data landscape that we're looking at of all these different data sets. And you're right, it is a form of real world data as well.
Yeah, and actually, again, it got me thinking. I was thinking of the big data companies. Obviously, Oracle is one of them, but you have AWS, you have Google, you have obviously Facebook and WhatsApps and all that whole company. Meta, is it now?
Right.
So you have these big conglomerates that hold a lot of data, and the syncing of that data will obviously be crucial. We're talking light years away from now, but it is still something that needs to be considered in the future about how people get the right data to be able to prescribe the correct drugs for the particular syndromes that they've got. I had that conversation with Tony D'Souza at the end season 1, and I can't forget it. It's fascinating, and I guess what I'm trying to get at is that we must remember that patient safety is the ultimate goal of what we're doing. And as long as we can get the right drugs to the right people at the right time, then we're doing our jobs correctly.
Exactly. And we're actually working on a concept. So what you just described is precision medicine, right? Getting the right medication to the right patient at the right time. We're working on something called precision pharmacovigilance, which actually uses this real world data as a component. And it's about avoiding the wrong medication to the wrong patient at the wrong time, or identifying those risks, basically, right? And you're right, that is what it's ultimately all about. It's protecting the patient from harm, and I think we have to keep that in mind as we think about these new technologies and putting them in place. We have to be careful, right? And we have to be compliant, and we have to keep the patient in the center of the picture. That's the ultimate thing that we're doing. That's why I'm doing this job, actually. I never expected to be working in pharmacovigilance, but as soon as I started, I realized, wow, I can make a real impact on the world, right? I can make the world safer for people, which is really fantastic, right?
Michael, thank you so much for joining me today. It's been a fascinating conversation, and I'm glad you answered some of the more tougher questions, which I wanted to ask. So thank you.